Hi, I'm Dr. Chrissy Elrod, a licensed therapist with a PhD and a breast cancer survivor with PTSD. And today I'll be talking about a complex factor in the patient-provider relationship, sometimes known as a double bind. This is where we experience our provider as someone who is healing us, saving our life, and as the perpetrator of medical trauma. So, this is a complex relationship that we have to hold within ourselves and within the patient provider relationship. Let's talk about it a little bit more. Medical providers can be both healers and the perpetrators of medical trauma. This creates a complex wrinkle in the patient-provider relationship. So, as adults, we understand that there are tasks that doctors must perform that may cause us pain, shots, surgery, and that's part of the healing process. But our bodies don't understand the terror, the confusion, and the panic of those experiences. From our body's point of view, we're allowing someone to harm us. During cancer, for example, it became harder and harder for me to drag myself to chemo. I just couldn't understand why I kept going back to the same place and feeling really terrible after I left. But it's specifically because of our socialization to medicine and because we assume that there's pure intentions behind all of these sometimes harmful and painful procedures. So we stay silent about our vulnerability, our intense emotions. So we're in a double bind with this experience as our providers both being healers of us and harmers, which they are healing us and also causing us pain. We understand that pain as being helpful in the long run to our health, but it's really difficult for our bodies to understand that. So, one, we're talking about a complex cognitive process of perceiving our providers as both healers and harmers. And then we're also talking about the complex internal process where we are taking our body to a place to be cut up, poisoned, those kind of things, all in the name of our long-term health, which is something that our body can't really understand in the present moment. This is very confusing to our brain and body, and it's part of what keeps us silent. So this is why it's important to bring it up, is because this complexity and having to hold two truths at one time or multiple truths at one time is really part of what's keeping us silent. So let's start talking about our medical trauma and our experiences both to each other and to our doctors.